Heart attack warning signs. 5 dangerous pills to avoid. 3D animation. You're trying to do everything right for your heart, aren't you? You take your meds, you watch what you eat, maybe you even exercise. But what if one of the most important factors for your heart health is hiding in plain sight, right there in your medicine cabinet? For millions of seniors, one of these 5 common pills could be quietly impacting your cardiovascular health. And the warning signs? They're not what you think. It's not always that dramatic, chest-clutching moment you see in the movies. Sometimes the body just whispers, a subtle change you might brush off for days or even weeks. Today, using some incredible 3D animation, we're going to show you exactly how these common pills can put a hidden strain on your heart and arteries. You'll want to stick around, because what you learn today could be a vital step in protecting your long-term wellness and the well-being of someone you love. The problem and agitation. Look, as we get older, keeping our heart healthy is obviously a huge priority. We trust our doctors and the medications they prescribe. But here's a concerning thought. Many common medications, even some you can get right off the shelf, come with potential heart-related side effects that aren't always printed in big, bold letters on the label. And research suggests that when older adults take multiple medications, a practice known as polypharmacy, the combined potential for a major cardiovascular event, like a heart attack or stroke, can climb significantly. This can be true even for people who've never had heart problems before. The issue is in how these chemicals interact with the delicate machinery of our heart and blood vessels. For a younger person, the effects might be minor, but for a heart that's been beating for 60, 70, or 80 years, even a small, steady strain can eventually lead to serious problems. The trouble is, we often blame the early warning signs on just getting older. But what if that new fatigue or indigestion isn't just an age thing? What if it's your body's way of sending an important signal triggered by a pill you take every single day? So let's get into what these 5 types of medication are. The pain reliever paradox, NSAIDs. First up, let's talk about something most of us have used, non-steroidal anti-inflammatory drugs, or NSAIDs. You know them as ibuprofen and naproxen. They're the go-to for everything from a headache to arthritis pain. But the way they work includes a potential downside for your heart. So how do they work? Well, to stop inflammation, NSAIDs block enzymes called COX-1 and COX-2. That's great for pain, but it also messes with molecules called prostaglandins. These prostaglandins are crucial for heart health. They help your blood vessels relax and tell your kidneys to get rid of sodium in water. Now, watch in our 3D animation what happens when NSAIDs get into your system. The production of those protective prostaglandins drops. Because of that, your kidneys start holding on to more salt and water. All that extra fluid has to go somewhere. It ends up in your bloodstream, increasing the volume of blood your heart has to pump. You can see the heart starting to strain, working harder against the extra volume. At the same time, without the relaxing effect of prostaglandins, the blood vessels start to tighten up, which makes your blood pressure climb. Studies have clearly shown this can increase the risk of heart failure, and for adults over 60, regular use is a well-known factor in hospital admissions for heart failure. And the subtle warning sign? It's not always chest pain. It might be new swelling in your ankles or feet, or a few pounds of unexplained weight gain. This is a classic signal of fluid retention. You might also feel unusually out of breath doing simple things, like walking up the stairs. That's literally your heart struggling to keep up with the extra work. For women, the signs can be even trickier, sometimes showing up as just overwhelming fatigue or indigestion that's new or getting worse. Now, let's look at the most critical moment. In our 3D animation, we see a coronary artery where a small plaque has been sitting quietly. Under the added strain of high blood pressure and the effects of NSAIDs, that plaque's protective cap can become thin and eventually rupture. Immediately, the body's repair system, those sticky platelets, rushes to the scene to form a clot. But if the clot grows too large, it can block the entire artery, severely restricting the flow of oxygen to the heart muscle. Without oxygen, the heart tissue begins to experience significant cellular stress and permanent injury. This critical situation is what defines a major cardiovascular event.
The decongestant deception, pseudoephedrine. Next on the list is a staple of cold and flu season, decongestants with pseudoephedrine. It works wonders for a stuffy nose, but it does so in a way that can place your whole cardiovascular system under added stress. Here's what's happening inside your body. Pseudoephedrine works by hitting on switches on your blood vessels called alpha-adrenergic receptors. When these are activated, the vessels constrict or get narrower. In your nose, that shrinks the swelling so you can breathe. The problem is, the drug doesn't just work in your nose, it goes everywhere, affecting blood vessels all over your body. As our animation shows, when pseudoephedrine is circulating, those blood vessels start to tighten. This forces your heart to pump much harder to push blood through those narrowed passages. Your blood pressure can spike, and your heart rate often climbs. Now, if you're young and healthy, your heart can probably handle that for a little while. But for an older heart, especially one that's already dealing with high blood pressure, that sudden extra workload can be a significant challenge, and it may increase the potential for a heart attack or stroke. The subtle warning sign here is often a feeling of a racing or pounding heart, known as palpitations. You might also feel an unusual sense of anxiety, nervousness, or get a headache you can't shake. These aren't just little side effects, they're signals that your cardiovascular system is under stress. For women, this might also come with sudden dizziness or pain in the neck and jaw that appears out of nowhere. The hidden risk in heartburn relief, proton pump inhibitors. Coming in at number 3 is a drug millions of people take every single day for acid reflux, proton pump inhibitors, or PPIs. You'll recognize names like omeprazole and esomeprazole. They offer relief, but a growing body of research suggests long-term use might have notable effects on the heart. Let's visualize how. PPIs work by shutting down the proton pumps in your stomach that make acid, but studies now suggest their effects might go far beyond the stomach. One major concern is that using PPIs for a long time may make it harder for your body to absorb magnesium. Magnesium is an absolutely critical mineral for your heart. It's a key player in keeping your heartbeat steady by regulating the electrical signals in your heart muscle. As you can see in the animation, when magnesium levels get too low, the heart's electrical system can get unstable. The signals can become erratic, potentially leading to significant irregular heartbeats, or arrhythmias. On top of that, some research points to another issue, the possibility that PPIs might reduce the body's production of nitric oxide, a substance that helps keep arteries flexible. Now, the research here is still evolving, but some large-scale studies have suggested a link between long-term PPI use and a higher risk of major cardiovascular events and kidney issues. And the warning sign here is so easy to miss. You might get muscle cramps or twitches, which is a classic sign of low magnesium. You might also feel a flutter in your chest or a new deep sense of fatigue. For women, that fatigue is a huge red flag, often paired with nausea that gets mistaken for the very stomach problem they're trying to treat. The sleep aid scare, anticholinergics. All right, number 4 is an ingredient found in a lot of over-the-counter sleep aids, anticholinergic drugs like diphenhydramine. People reach for them hoping for a good night's rest, but they could be affecting the heart's natural rhythm. Think of it this way. Your body has an accelerator, the fight-or-flight system, and a brake, the rest and digest system. The chemical messenger for that brake pedal is called acetylcholine. It's what tells your heart to beat nice and slow when you're resting. Anticholinergic drugs work by blocking that messenger. As our animation shows, when you take one of these sleep aids, the brake signals to the heart get muffled. With that calming influence gone, the accelerator system can take over even when you're supposed to be resting. This can stop your heart rate from slowing down like it should, and even make it speed up, a condition called tachycardia. For an older heart, losing that brake pedal can lead to electrical instability and a higher risk of arrhythmias. The ongoing warning signs are often confused for something else. You might wake up feeling dizzy or confused, which many people just call a sleep hangover. A dry mouth or trouble urinating are also classic side effects, but a more direct heart-related sign is feeling lightheaded or having a faint fluttering sensation in your chest, especially when you're lying down. For women, these symptoms can come with a feeling of anxiety or shortness of breath that seems to appear for no reason. The depression drug dilemma, tricyclic antidepressants or TCAs. Newer drugs are more common now, but TCAs like amitriptyline are still prescribed, sometimes not for depression, but for things like nerve pain or migraines. These drugs affect brain chemistry, but they also have notable effects on the heart's electrical system. Think of your heart's electrical system like a circuit. It depends on a super fast flow of sodium ions to create the spark that makes it beat. Tricyclic antidepressants can act like a roadblock for these sodium channels. As the animation shows, this blockage slows down the electrical signal as it moves through the heart. On an EKG, doctors can see this as a widening of certain parts of the wave, a clear sign that things are slowing down. This slowdown can raise the risk of developing significant arrhythmias. Even at the right dose, these drugs can cause your blood pressure to drop suddenly when you stand up. It's called orthostatic hypotension, which is a major reason for serious falls and fractures in older adults. The most common warning sign is dizziness or lightheadedness, especially when you get up from a chair or out of bed. That's a direct result of that blood pressure drop. You might also notice a fast or irregular heartbeat that doesn't go away. For women, this might show up as extreme fatigue and pain in the upper back or shoulder, symptoms that are all too easy to dismiss as a simple muscle strain. So, to recap, we've seen how 5 common types of medication, NSAIDs, decongestants, PPIs, certain sleep aids, and tricyclic antidepressants can put an unseen and significant strain on your heart. We've seen how they can lead to fluid retention, spike blood pressure, and mess with your heart's rhythm and electrical system. And we've learned that the warning signs are often subtle things like swelling, a racing heart, unusual fatigue, or dizziness. Now, this is the most important part of this video. This information is not meant to cause alarm or to tell you to stop taking your medication. Absolutely do not stop taking any prescribed medication without first speaking with your doctor. Doing so can have serious health consequences. The whole point of this is to empower you. You now have critical information that most people don't. You understand the why behind these potential risks. Your job now is to be an active partner in your own health. Take a look in your medicine cabinet. If you are regularly taking any of these medications, especially if you're taking more than one, the next step is to talk to your doctor or pharmacist. Ask them, could the symptoms I'm feeling be related to my medication? Are there safer alternatives for me, considering my age and my health? If you found this information valuable, please consider sharing this video with your friends, family, and anyone over 60 you care about. The information could be very helpful for them. And for more deep dives into your health, make sure to subscribe and hit that notification bell. What was the most surprising pill on this list for you? Let us know in the comments below. Thanks for watching. Stay informed, stay proactive, and take charge of your health.